First of all, I would like to thank you, the organization, for inviting me to talk about this topic. These are my disclosure. First of all, a few words about von Willebrand factor domains and its function. Von Willebrand factor is a multimeric and a multifunction glycoprotein with several domains. Each of it contributes for one or more functions. It is not possible for this reason to use only a single test to study the entire function of von Willebrand factor. Different biochemical tests are available to analyze the function of the protein, which needs to be performed step by step. In these slides, we see the von Willebrand factor precursor, also called von Willebrand factor. So we can see the different domains involved in the function of the protein. The first and the three domains, which accounts for the binding to factor VIII, A1 domain involved in the GP1B alpha and collagen D6 binding, A2 domain, that is the cleavage site of ADAM13, A3 domain, that is the binding site for collagen 1 and 3, and so on. In these slides, we are going to see the flow chart for von Willebrand disease diagnosis. Von Willebrand disease diagnosis is based on three fundamental criteria. The first one is the positivity of the patient's bleeding history. The second is the reduced von Willebrand factor levels. The third is the presence of bleeding family history. With the first level test, which are factor VIII coagulant activity, von Willebrand factor antigen, and von Willebrand factor Ricoff, we can diagnose some von Willebrand disease variants. For example, with undetectable levels of von Willebrand factor antigen, we can diagnose von Willebrand disease type 3. If there is a discrepancy between the activity of von Willebrand factor and its amount, we can diagnose von Willebrand disease type 2. If there isn't this discrepancy, and so if the ratio of von Willebrand factor Ricoff to antigen is above 0.6, we can diagnose von Willebrand disease type 1. With the second level test, we can diagnose other variants of von Willebrand disease type 2. And so, with the RIPA test, we can diagnose von Willebrand disease type 2B. With multimer analysis or with the von Willebrand factor collagen binding, we can diagnose von Willebrand disease type 2A or 2M. With the ratio propeptide to antigen, we can better understand the half-life of the protein. And with von Willebrand factor VIII binding, we can diagnose von Willebrand disease type 2N. Also, molecular diagnosis plays an important role in the von Willebrand disease diagnosis. We can spend some words about it at the end of the presentation. So let's go inside the von Willebrand diagnosis through all the second level tests, starting from the von Willebrand factor multimeric analysis. With the low resolution GILs made with HGT agarose, we can detect both both high and intermediate multimeric weight loss as occurs in 2A von Willebrand disease patients. We can also detect loss of high molecular weight multimers as occurs in 2B patients. With intermediate resolution GILs made with a different agarose, made with LGT agarose, we can better characterize other variants of von Willebrand disease type 2 patients. Another important second level test is von Willebrand factor collagen binding assay. Here we can see the A3 domain involved in the subendothelium collagen binding. With von Willebrand factor collagen binding, we can measure the activity of this protein. Von Willebrand factor collagen binding can be measured by an ELISA test. Many types of collagens can be used in this test. Type 1 collagen is more sensible to discriminate von Willebrand disease subtypes and is more sensible to high molecular weight multimers, but it suffers of poor reproducibility. There are some parameters that influence the collagen binding assay. These are multimeric pattern and mutation in the A3 domain. Another important test is von Willebrand factor VIII binding. This test can allow us to discriminate between 2N patients and the mild hemophilia A patients. Is performed by 2 ELISA tests. At the end of the test, we can perform a graft, and we can discriminate between normal patients, heterozygous patients, and homozygous patients for the typical mutation responsible for the disease. The measurement of von Willebrand factor propeptides is also important. Let's see the role of propeptide. Von Willebrand factor propeptide and the mature von Willebrand factor completely dissociate after release into their circulation. Plasma von Willebrand factor concentration represent a balance between synthesis, secretion, and clearance from the circulation. Von Willebrand factor and von Willebrand factor propeptide are secreted equimolarly, but clearly independently, with different half-lives, 8 to 12 hours for von Willebrand factor and 2 hours for propeptide. So, propeptide to antigen can be used to assess in particularly the rate of clearance of von Willebrand factor, providing insights into the pathophysiological mechanism of von Willebrand disease. Since 2010, have been published different papers on the role of von Willebrand factor propeptide into the diagnosis of von Willebrand disease. The last paper was published in 2014 by the Dutch group. These authors reported the measurement of von Willebrand factor propeptide in type 1 and type 2 patients, and also in variants of von Willebrand disease type 2. The key points of this paper was that propeptide discriminates between type 3 von Willebrand disease patients and severe type 1, with very low von Willebrand factor levels. The next two second-level tests I'm going to present must be performed on fresh blood samples. The first one is ristocetin-induced platelet agglutination, also called RIPA. This test is performed with platelet-rich plasma from a patient and different concentration of ristocetin. So we can see a curve made on normal individuals where agglutination is reached with a concentration of 1.1 milligram per ml of ristocetin. In a patient affected by 2A von Willebrand disease, agglutination is never induced even at high concentration of ristocetin. In a patient affected by von Willebrand disease 2B, agglutination is induced even at low concentration of ristocetin. Von Willebrand factor intraplatelet analysis can be performed after isolation of von Willebrand factor by platelets made with centrifugation at low speed. After that, platelets von Willebrand factor antigen and von Willebrand factor record should be assayed within 2 weeks. Now, some consideration about external factor which can modify von Willebrand factor levels. First of all, the gender, because females may exhibit a greater variability. Then, the age, because von Willebrand factor is higher in older individuals. Also, we should consider hormones, the role of hormones, because estrogen and thyroid hormones can increase von Willebrand factor, masking lower baseline values. Also, exercise and stress, because von Willebrand factor increases. And also, blood group 0, because von Willebrand factor is lower. Now we should consider the limits of the phenotypic test. Von Willebrand factor disease is very heterogeneous. Many pre-analytical variables can modify von Willebrand factor levels. Now, you know, more than one assay is necessary to make a correct diagnosis. And unfortunately, most of von Willebrand factor assays are not standardized. Before, we told that also molecular genetics plays an important role. This is the mutational database you can see to look for the mutation responsible for the disease. And now we can see the contribution of molecular diagnosis. It can determine the genetic defect of von Willebrand factor when phenotypic diagnosis is uncertain, and it can make a definite diagnosis of von Willebrand disease when the phenotypic diagnosis is uncertain. Thank you for your attention.